Good afternoon. I'm Congresswoman Lori Trahan, and I want to thank you for joining today's telephone town hall, our sixth since this pandemic began. I'm so glad to be joined today by two outstanding guests, Professor Monica Galizzi and Dr. Pardus Sabeti, who will spend the next hour helping me answer your questions about COVID-19, our economy, and what our path forward might look like. Before we get to your questions, I'd like to give you a brief overview of where we are in the fight against this virus and give an update on the additional relief coming from Washington. So nationwide, more than 1.3 million people have tested positive for COVID-19, and tragically, over 81,000 men and women have died. Our state currently has the fourth highest number of cases in the nation, with more than 78,000 people testing positive, and the third highest number of deaths, with more than 5,000 people succumbing to the virus, nearly 60% of them residents in long-term care senior facilities. The economic harm to our workers and entrepreneurs continues to worsen. Earlier today, we received updated unemployment numbers. In this past week, nearly 3 million more people filed for unemployment, bringing the total number of applicants nationwide to 36.5 million since mid-March. Here in Massachusetts, more than 44,000 people filed last week, putting us just over 1 million workers who have filed for unemployment benefits since this outbreak began. These numbers are staggering, and the threat of the coronavirus remains so serious for all of us. But we have begun to flatten the curve in recent weeks, and that's thanks to each of you. Your commitment to staying informed, staying positive, and most importantly, staying home has gone a long way toward slowing the spread of COVID-19, and I'm so grateful to each of you for doing your part. The reality is that our collective action did prevent a surge on our community hospitals, and we owe that to our hospitals' preparedness, but also to all of you for staying home. We're not out of the woods yet. As the number of new cases declines, it's important that we acknowledge that our heroes are still fighting around the clock to save lives and to keep us safe. And they're relying on us to continue acting responsibly, even as we turn part of our attention toward the governor's newly released plan to reopen our state. I know we'll be talking more about the governor's plan later. However, it's important that as we think about the best way to reopen Massachusetts and to jumpstart our economy, we do so in a way that protects workers and their families while also preventing another surge in coronavirus cases. I think Dr. Fauci said it best when he testified before the Senate on Tuesday, cautioning that if states or cities reopen too soon, there is a substantial risk of another outbreak that may be hard for us to control. So it's incumbent upon us to be cautious, agile, and vigilant as we wade these new waters. And as we continue to meet the milestones pivotal to ensuring a safe reopening, it's also critical that we understand that the road to recovery may be a long one, which is why I'll be working in Washington to make sure you have the resources you need to get through this. So far, Congress has passed $2.7 trillion in emergency relief funding to help families and small businesses, and to keep our healthcare heroes, first responders, and emergency workers safe. But what's clearer now more than ever is that we are going to need to do a lot more to ensure that we don't leave anyone behind. That's why I'll be returning to Washington tonight to vote on the HEROES Act, a $3 trillion relief package that delivers on many of the needs of our heroes working on the front lines, our working families who are doing everything they can to make ends meet, as well as vital aid to our states, our cities and towns, and hospitals. Specifically, the HEROES Act provides $75 billion for the testing, tracing, and treatment we need in order to have a science-based path to safely reopen our country, giving every American access to free coronavirus treatment. $1 trillion for state and local governments that desperately need funds to pay for healthcare workers, police, fire, transportation, EMTs, teachers, and other vital workers who keep us safe and are in danger of losing their jobs. It will also establish a $200 billion HEROES Fund to ensure that essential workers receive hazard pay. For families struggling to pay their bills, this legislation provides a much-needed second round of direct cash payments of up to $1,200 per person and $6,000 per family. It allocates another $175 billion to help cover rent, mortgage, and utility payments, and expands federal subsidies for COBRA premiums so that families don't go without health insurance as a result of COVID-19. It also includes $100 million to provide direct services such as home-delivered and prepackaged meals and supportive services for our seniors and disabled individuals and their caregivers. Through CMS, states will get $150 million to establish and implement nursing strike teams that would deploy to senior living homes or skilled nursing facilities like the Life Care Centers within 72 hours of 3 residents or employees being diagnosed with or even suspected of having COVID-19. It builds in incentives for long-term care facilities to create COVID-19 specific facilities and includes safety and quality protections for patients. Furthermore, the U.S. Department of Health and Human Services would be required to provide additional assistance to facilities struggling with infection control and collect data on COVID-19 in nursing homes, which would be publicly reported. The HEROES Act also provides additional funding for our food security programs, things like SNAP and WIC, food banks, and child nutrition programs. And for our students who have been doing such an incredible job learning from home over these last 2 months, this legislation provides $90 billion for state and local governments to ramp up online learning and close the digital divide that exists in too many urban and rural communities. It improves and extends the Paycheck Protection Program to ensure funds are getting to true small businesses and nonprofits to keep them afloat as they take steps to responsibly open. Passing this bill will be an important step, and the Senate should move without delay to pass it as well. Now, before I introduce our star guests, I'd like to take this moment to thank you all again for your commitment to staying informed and to keeping our community safe. You know, each day that we continue doing our part gets us that much closer to the stay-at-home order being lifted. So please continue doing what you're doing so that our emergency workers can continue to do their jobs. Stay at home as much as you can. Keep washing your hands and disinfecting those frequently touched surfaces. If you have to go out in public, be sure to wear a mask and maintain social distancing. And most importantly, check in on your loved ones, virtually or by phone, so that we all stay connected. These past 2 months have been a marathon, and we're all feeling stressed, exhausted, and isolated. But there is a light at the end of the tunnel, and it's so important right now that we remain committed to staying the course so that we all get through this together. Okay, now I'd like to take a moment to introduce our expert panelists who will be answering your questions for the next hour that we have. Our first star is Dr. Monica Galizzi, Professor of Economics and Chair of the Economics Department at UMass Lowell. She was born and raised in Piacenza, Italy, and came to the United States in 1987 to further pursue her studies. She holds an Italian Doctorate of Research in Economic Policy and a PhD in Economics from Boston University. Prior to joining the University of Massachusetts at Lowell, she worked at the Workers' Compensation Research Institute and at the National Bureau of Economic Research. In 2007, she won the Eckstein Prize, awarded biennially by the Eastern Economic Association to the author of the most outstanding article in the Eastern Economic Journal. In 2008, she received the Teaching Innovation Program Certificate of Achievement awarded by the American Economic Association Committee on Economic Education. And in 2012, she was nominated to become a new member of the National Academy of Social Insurance. At UMass Lowell, Professor Galizzi teaches classes in the principles of micro and macroeconomics, labor economics, and health economics. Additionally, she's a member of the leadership team of the Center for Women in Work and serves on several committees at the department, college, and university levels. Professor Galizzi, we are so pleased you could join us today.
You're welcome. I'm happy to be here and contribute any way I can. I am a labor economist, which means I study how employers and workers interact and how this interaction affect the profitability of businesses as well as the well-being of workers and families. And I've been studying for a long time how when a big shock happens in the life of a worker, such as a health event or an injury, how this affects the long-term economic well-being of this person and the household. So I'm coming to the analysis of this crisis with this background. As you said, I'm also from Italy, and so I've been observing what that country and what Europe has started doing to handle this crisis a few weeks before we face it. And so this is what I'm bringing to the table.
Well, thank you. I know that we're going to benefit greatly from your expertise and your insight. Our next star is Dr. Pardus Sabeti, a distinguished computational biologist, medical and evolutionary geneticist. Dr. Sabeti is currently a professor at the Center for Systems Biology and Department of Organismic and Evolutionary Biology at Harvard University and the Department of Immunology and Infectious Disease at the Harvard School of Public Health. She is also an institute member of the Broad Institute of Harvard and MIT and a Howard Hughes investigator. Dr. Sabeti is a World Economic Forum Young Global Leader and a National Geographic Emerging Explorer. Finally, she was named a Time Magazine Person of the Year as one of the Ebola fighters. Dr. Sabeti, thank you for taking the time to be with us today.
Thank you so much, Congressman Trahan. I'm so pleased to be here and I'm grateful for this opportunity to connect with the community and looking forward to the conversation.
Terrific. Well, we're thrilled to have both of you here today. And I'll just say I was enormously proud to describe this particular expert panel to my 6- and 10-year-old daughters and show them examples of women leading in science, economics, and academia. So without further delay, let's dive into your questions. Dr. Sabeti, the first question is for you, and it comes from Susan K. in Lowell. She asks, with testing becoming available, should I go even if I have no symptoms and get tested for the virus and tested for the antibodies?
Okay, well, yeah, thank you, Susan, for the question. It's a very good question, and it's one that we're all trying to figure out ourselves. So, let me try to unpack the kind of different questions you have. So, it's the idea that if you don't have any symptoms at all, should you get tested? I mean, there are, in that case, the reasons to get tested is if you, either have symptoms and are worried that you're ill, or you've been in contact with someone that has been ill, and you want to, be sure that you're not an asymptomatic carrier. As we know with COVID, there are a lot of asymptomatic carriers, and that will have the spread go further if that's the case. There are times in which we are doing testing of individuals who are healthy, even without a potential risk exposure or another reason to be suspect COVID, and that is in cases where it's something that's being contemplated on a broader basis for return to work, for doing screening. And so those are some of the things that may roll out, is screening of healthy people just to test to see if it's available. That will hopefully get a lot more pleasant if, as the technologies are, a lot of papers have come out to say, and a great one out of Yale, but others out of China as well, that shows that saliva, that the virus is in your saliva, and in fact it's even more sensitive, that there's higher amounts of virus in the saliva, and that it may be around even for a longer period of time in your saliva. And that all just makes testing a very different proposition. You imagine if every time you had to get tested, you had to take a nasopharyngeal swab and essentially tickle your brain to do it. People wouldn't want to do that. So those are the things that hopefully will have breakthroughs so that testing can become more available and more accessible to a lot of people. And I know right now that's the big issue is getting access. But it is something where there's a lot of discussion about testing people who are healthy. I think you'll continue to hear about that, and we'll see where we're at each point. But I do think that I'm somebody who spent a lot of my career doing diagnostics and surveillance work, and so believe very much that detection is a necessary, not sufficient, but the necessary kind of step to the foundations. And so hopefully we'll make that something that's possible, but ultimately it's something you do for specific reasons. And the other question you had is about the tested for antibodies. In that case, yes, a lot of people are doing testing for antibodies, and it's a very interesting area and potentially exciting area to see whether or not we can start to identify people who have been exposed and may get a sense of what is our herd immunity, who are the people that might be protected. There's a lot of open questions still about that. There's some sensitivity and specificity issues of the tests themselves. That means how accurate are they, and how much do they tell you? And then there's the questions of what does it mean if you've had exposure, and does that really, we still are, a lot of that is still coming into focus.
Terrific. So thank you for that, Dr. Sabeti. I mean, that is a common question that we get. Is it safe to say that we don't know if you've had the virus, it doesn't necessarily mean that you're immune?
Yeah, great question. And I think that for that one, it is also still, this is one of these very interesting situations in which we learned about the virus in December. And here we are just a few months later trying to learn as we go, build a plane as we fly, understand it. And, we have had some experience to a virus like this, SARS, this is a very SARS-like virus, and MERS and others. So we have some understanding of the immunity, and there's researchers all over the world looking at this right now, but we still haven't looked at enough individuals we don't have enough cohorts and studies of individuals who have been infected, and then and then to see whether or not they've been reinfected. We'd actually have to do a number of things to do that well. We want to have those antibody tests available to start saying, what does the immune response look like? Are they mounting immune response? Do we see one here? We'd actually want to be testing regularly to see if any point if they have gotten the virus again, and we'd also want to sequence any cases that we see. That means reading out the entire genome sequence of the virus itself. And what that does is it's a way of really identifying that, not just that you have COVID, but you have a particular instance of COVID, of really taking a close look at the virus. And that means so if we ever saw anybody test positive and then again test positive sometime later, we would be able to say, hey, has this person been reinfected, or are they just carrying that same virus that's sort of showing up again somehow? So I think those are the things that we still don't know. But there's a sense, we see obviously in a lot of immunology and in medicine that once you've been exposed to a virus, you either don't get it again or you're at lower risk. But those are the things we still need to figure out. And as we really contemplate these serology tests, a question we have is, what does it mean? Does it mean you can't get it again? Does it also, that's one important question, is are you yourself safe? And then the other important question is, does it mean you can't carry it and give it to somebody else? So what if it protects you from getting disease, but you still could carry the virus? Are you truly, immune and protected? So anyway, those are, I don't have specific answers yet. I can just kind of guide you through what are the things we're doing to be able to answer them. So we don't know yet. So even if we start doing this serology or start thinking about that, we don't yet know what that means. But we're figuring it out as we go.
Yeah, no, absolutely. And it's so helpful. And it's a good reminder of how early we are in understanding, this virus. So thank you for that. Professor Galizzi, Danielle B. from Chelmsford wants to know, are considerations being given to the need to have childcare in order to reopen the economy? Working parents without childcare are being woefully left behind and unsupported. Could you speak to that?
Yes, I think Danielle is unfortunately hitting on one of the key elements which will make possible for us to go back to whatever is going to be the new normal. So have we thought about the issue associated with childcare? In a way, we have, because the first response we had with the Families First Coronavirus Response Act, which was passed in March, made possible for your employer to pay you up to two-thirds of your regular rate of compensation for up to 12 weeks if your child was in a school which was closed or if your child care center closed. Unfortunately, the reality for most families right now is that this 12 weeks period is coming to an end. And unless we are coming with new proposal, we are putting new proposal on the table on how we specifically address the needs for families with children, we are really creating a situation which is unsustainable for working families. I understand that the president of the Senate in Massachusetts, Karen Spilka, is pushing for an effort to use some of the funds to support households with childcare. But the truth of the matter is that schools are closed, childcare, most daycare centers are closed up to the end of June, and summer camps and the opening of summer programs is completely still up in the air. I do think this is an area where maybe people who are in control and design policies may want to look a little bit at what is done in other countries and what has happened in other countries, where intervention have ranged from providing public child care to working parents in essential services to give direct financial support to workers with children. In my country, in Italy, we're talking about a babysitter check. So families below a certain income level receive a set amount of money per child to support them through these times. Other countries are giving financial subsidies to employers who provide workers with paid leave, or maybe push for more flexible work arrangement, for example, in some public jobs, in public sector. I also would like to take this opportunity to add, bring focus to something which I don't think is discussed. We are talking about child care, but I am afraid that something we are ignoring is what is going to be the need for elderly care. I read more and more that family, legitimately so, are revising their idea of potentially sending the elderly parents and so on in assisted living facilities, in nursing homes, because of the fear of the virus. And so I think household will be potentially, until we find a vaccine, will be potentially dealing with additional, let's call it, burden of elderly care. So I think this will have to be recognized, I think, by any kind of policy which tries to address this issue. I think it would be interesting to move a little bit quickly now, especially for the summer. I think we have, unfortunately, an army of young people who are graduating, looking for jobs, not finding jobs, and potentially could, at least over the summer, provide support to families. But I think it would be nice to have this effort regulated. This is what I think where we are, as far as I know.
No, thank you so much. There is no question that COVID-19 has put a spotlight on so many of our gaps in our system in terms of, we have over 30 million people who didn't have access to paid sick leave. We don't have paid family and medical leave standard in our country, even childcare. We've got 1 in 3 essential workers. 1 in 3 essential workers are women. They wake up each day and they go to work to deliver life-saving services, and they need childcare, right? So this is a big issue. I'm hoping that because I took office with a record number of women, that we can get at this, because it was an issue before COVID-19. It certainly has been exacerbated, and it will continue to be. As you just described, care is going to take on a whole new meaning as we go forward. And frankly, our nation's long-term well-being and our economic recovery will depend on a care infrastructure that's equitable, one that works for every family. I think this next question is for me, and it comes from Pat B. in Concord, and she asks, while everyone is being affected by this virus, people of color and people with lesser means seem to be impacted in higher numbers. What is our state doing to mitigate this? Pat, it's indisputable that the COVID-19 crisis has a disproportionate impact on communities of color, and that's on all fronts, from per capita hospitalization and deaths to economic hardship. And I do think that COVID-19 has woke many people up to the disturbing reality that this pandemic exacerbates existing barriers that people of color, people with less income, those living in under-resourced areas, and people with disabilities face and have faced well before COVID-19. And it's unacceptable. I do think that in order to change these disparities, we need data, and we frankly need courage. I joined my friend and my colleague, Congresswoman Ayanna Pressley, in introducing legislation that would require the federal government to collect and report racial and ethnic data related to COVID-19. The CDC, the Center for Disease Control, has released very limited racial and ethnic breakdowns on the impact of the coronavirus. And still, with that limited lens, the trends are disturbing. We need a complete picture so that we can direct resources and policies to get at this problem in its totality. The lack of information is concerning, particularly because data on race and ethnicity is crucial to understanding if testing and information is accessible across communities of color, especially in immigrant communities like Lowell and Lawrence. So our bill is designed to ensure that we have the data necessary to optimize relief efforts for minority communities. But let's be super clear. The data is just the first step, and I suspect that the data is only going to confirm our instincts. So we need to be ready to make dramatic changes on how we educate all of our children, how we create career pathways that haven't traditionally been accessible to kids in gateway cities like Lowell, Lawrence, Haverhill. We need to extend healthcare and childcare to everyone in this country and extend opportunities that have been systematically barricaded from communities of color. So, Pat, thank you. Thank you for your thoughtful question. We certainly have a lot of work ahead of us. Okay, so Dr. Sabeti, we're going to turn back to you for this next question. It's from Susan B. And you spoke a lot about testing and the virus and how much, where it's evolving and how much we're learning. She wants to know specifically about contact tracing, how that's progressing, and maybe just, what it is for folks who don't understand, what it means. Will it be used as a metric on how Governor Baker will reopen the state for business?
Yeah, sure. So, contact tracing is fundamentally based on is the ability to track down any individual who's been in contact with somebody who has tested positive for COVID. And it's our ability to see how far a particular, the case of COVID has been able to go and to move and to spread. And in the ability to do that makes it so that we can stop these new outbreaks, these new infections, and stop sort of the individual spread of the virus. It's fundamentally based on the fact that viruses are communicable. They're spread from person to person. That's an important piece of information that we have in general in our medical care system that helps us, right? With so many things, we don't know why people get certain diseases. The nice thing about infectious diseases is it's very simple calculus. If you see the virus, you'll be that is the exposure that will cause a risk. So it's good that we know that and we can use that information. And it's undeniable the importance of contact tracing in stopping these outbreaks. It's and also the undeniable the need to be able to use the best technology that we have to do so, to be able to get that kind of information in real time. Even prior to the COVID outbreak, we were here at Harvard and across the higher ed consortium in Boston, in this Boston area where we have 110 institutions of higher learning, we really got deep down into the value of contact tracing, because we saw this mumps outbreak spread from the sports teams at Harvard to the residential colleges to the dining halls, and we were trying to get as much real-time information as possible to see where this virus was popping up in different places, and as it was then showing up on different campuses. And even at that point, we started developing apps and thinking about the different kinds of ways that technologies could be used, like Bluetooth and GIS coordinates, to help us really track it down as well as possible and to inform people when they may have been exposed. And so there's a lot of efforts here in Massachusetts and around the country to enhance those kinds of technologies and enhance that ability. So far, they have not. The contact tracing that's happening has still been relatively traditional, using phone contacts and calling. There are some different, actually a dizzying number of apps that people have developed, but still not that much adoption of them in order to be used. And ultimately, kind of, Susan, to answer your question, it's one of these things that is so powerful, but has to be used really, really well. And I think it's an important metric for Governor Baker to reopen it, is how well are we tracking down these cases, and something that everyone's on top of to try to make happen, but also has to be done very, very well, right? So one of the big things that we're seeing in places like Chelsea, pointing to this important issue of populations that are more vulnerable, is that people don't want to come to attention and they don't want to be engaged because they don't trust the system is going to take care of them. They're afraid that they'll be reported for immigration, or there'll be something else that happens. In Seoul, we're seeing a crisis right now where the contact tracing is really needed to stop an outbreak from spreading, but it was also leading to discrimination against LGBT individuals because of the nature of the individual's evening. So that is it is one of these very, very important, very, very fraught issues. And to kind of go back to, so that's a lot of where we're at. To go back to your question, I think it will become contact tracing. So is progressing. There's a lot of activity towards it. We're not there yet. We're not in this country. We're not doing it the same way as some of these other countries where they institute it and they require you to do it. We're trying to get adoption, and we're trying to be thoughtful about how it's done, so it's done carefully and doesn't lead to misuse or exploitation. But our ability to identify cases is going to be very critical to our ability to come back as a society and to engage. That we need to know that one event, one super spreader event, doesn't put us right back, back to square one. So we have to be moving that as fast as we can, and that's sort of why the community is working as hard as they are to develop something that can be used.
Well, I certainly thank you for your leadership on that. I mean, we're fortunate that the Commonwealth has been a leader in this space. And, for those of you that aren't familiar, in April, the Massachusetts Department of Public Health contracted with Partners in Health to create the Contact Tracing Collaborative, which manages this statewide operation. And I do want to flag for everyone who's listening now that some people assume that these calls from contact tracers or case investigators are spam, or it's a hoax, and they're not answering their phones when reached. And so my message is, help us help you. All contact tracing calls start with the prefix 833 or 857. So please pick up the phone if you get that number on your caller ID, because your participation is vital to tracing, isolating, and stopping COVID-19 in its tracks. Okay, this next question it's actually from me, and it's to Professor Galizzi. You have researched in depth the employment outcomes of injured workers over a time period when the country introduced policy reforms that increase labor market flexibility with reduced job security. And in many ways, it's kind of what we're seeing happen in America's market right now. What advice do you have for those who are looking to the job market of the future?
Okay, so I think there are some similarities and some big differences between what happened to an individual who has a major negative shock, such as an injury, and what happens to his or her working life. compared to what happens to people who are losing their job now. So in a way, the problem whenever there is a job interruption is that people end up losing income because any time of work somehow leads to a deterioration of your skills. You lose knowledge of what is happening in your company, in your business, and so this makes you less marketable, less appealing when you're trying to find another job. And this is clearly something which happens to a worker who get injured and to a worker who now loses the job because of the virus. Now, the difference is that usually previous individual events, such as a job injury or, you were fired or whatever, come with a stigma, come with make very single you out. Now we are all on this together. Clearly, people have been hit very differently, as you pointed out before, depending on the jobs, industries they were dealing with. But nobody can be considered at fault for what is happening to him or to her. The economy was put on a stop because we needed to stop this virus. So if you lost your job, it's not because you were not performing well. It's not because you did something which was not working out. It was not a good match between your employer. You just couldn't go back to work because they told you couldn't do any longer because it was no longer safer. So in a way, workers who face this wave of layoff will not have, if you want, the burden of, that is often carried by people who are the only one losing their jobs in a community or in their network. So this is the good news. There is I don't think there is going to be a stigma which is going to affect your likelihood of being appealing to an employer down the line. The bad news here is, however, that any time this kind of crisis happen, we don't go back to where we were before. Things change, and often the burden of a change is put on worker. To give you an example, pre-virus, the big discussion among labor economists was, okay, now that we have this wave of artificial intelligence and new technology, what will happen to jobs? And one of the answers, which was sometimes given, was, well, some of the jobs which will be safe despite this artificial intelligence and so on wave are going to be the jobs which require a lot of human interaction, a lot of customer relations. Those are the jobs which are always going to be needed, where you will never be able to replace the human with the robot. Now we see in this situation that we are exactly at a crisis with those type of jobs. So this is saying that workers now, more than even before, in a way when they enter the labor market or when they try to go back to the jobs, really have to be aware that probably the idea of a job which is the traditionally job, long-lasting job and so on, is which maybe they observe their parents having, was not feasible already any longer, is going to be even more difficult to get down the line. And when I'm saying the burden is going to be put on workers, is because workers are going to be put in a situation where they will have to revise and update their skills continuously. I think this actually, we over the last 2 months, most of us were forced to become very familiar with working online, functioning online. Maybe now is a time for pushing even more opportunities and reinforcing the structure which can provide that type of education to workers who need to update their skills. So I'm thinking about, I understand there is no money, we're strapping for money, but institutions such as community colleges, or let me, say state university or state institution which provide somehow a more affordable education are really the places that need to get support, because workers need to be able to go back to places where they will develop the skills for the jobs that are going to be available to them at this point. So the message to potential workers now is going to be, yes, you are on the front line, even if you are not an essential employee, in the sense that you really will have to do a lot of work to reinvent yourself for an economy which is not clear, the shape it will be. And yes, the effort is going to be put on you in terms of getting ready and gaining the skills that are going to be needed now. But I think the government needs to make it easier for them by supporting the institutions which can provide them with this type of education.
That is terrific, and there's no question that workplaces, jobs are going to change in some cases dramatically, which will absolutely impact our workforce training, how we educate our young people and all people. So I sit on the Education Labor Committee, and what that sounded like is I need to invite you down to Washington. Actually, we're meeting on Zoom these days, so but you must testify in front of our committee on what we need to be prepared for in terms of reverse engineering our education system to deal with these adjustments that our workers ultimately will have to make. So thank you for that. Okay, I'm going to take this next question. It's from Rebecca in Bloxborough. She wants to know, what is the status of post office funding and what is being done to protect it and fully fund it? That's a gret question. And I've actually heard from a lot of constituents about the Postal Service. During this ongoing public health crisis, our frontline postal workers and our post offices, they require immediate support to maintain our on-time, consistent deliveries that, frankly, we've relied on for centuries. This service is especially important right now, especially for vulnerable populations like our seniors and those with disabilities, people who rely on mail deliveries for medicine, for food, and other essential supplies. So as we inch closer to the upcoming presidential election and ramp up our efforts to vote by mail, for example, our Postal Service will play a key role in sustaining our democracy, ensuring that everyone can access the ballot box in November. Earlier this year, the Postmaster General of the U.S. Postal Service projected that they would lose $13 billion in revenue this fiscal year and run out of funds by September without substantial federal relief. And it's for that reason that I support the Protect Our Post Offices Act. It would provide emergency funding to the Postal Service. These funds would replenish lost revenue, purchase PPE for our postal workers, and it would maintain our postal offices. I'm pleased to share that this bill, it was incorporated into the package that I'll be voting on in Congress tomorrow. In fact, the HEROES Act included $25 billion to keep the Postal Service open and help protect the mailmen and women we've all come to know so well. So as we craft and negotiate additional funding packages to mitigate the impacts of COVID-19, I will certainly continue to work with my colleagues to ensure that the Postal Service has the resources necessary to protect postal workers so that they're given the help that's critically needed to safely continue providing those services we've come to rely on. So thank you for that question. Dr. Sabeti, Ben from Dracut asks, given your experience with the Ebola outbreak, what other challenges do you think we are facing or will face because of these stay-at-home and isolation measures that we've had to put in place? Should we be preparing for mental health issues post-COVID-19 in both children and adults? Dr. Sabeti, did we lose you or are you on mute?
I am on mute. There you go. So, sorry about that. I was trying to reduce the noise while I was off. Yeah, I was saying, Ben, that I appreciate that. That's a question that's near and dear to my heart. We are fundamentally going to see some really a lot of collateral damage, a lot of serious impacts from social distancing, and I don't think any scientist is for social distancing, at its base. No one wants social distancing to happen. The frustration that most scientists feel, and most people in the field, like I feel, is that there should have been a lot more funding and support well in advance to make sure that we had this, the ability to detect and survey everywhere, so that we wouldn't be in this kind of position, because social distancing is fundamentally a blunt instrument that is, Molly Kimball, my lab, sort of kind of always infuses this in me, this importance, how challenging and how terrible it is. And the fact of the matter is that what wakes me up in the morning every day and gets me motivated to keep going 7 days a week, 20 hours a day, is knowing every single person who is trapped in a home that is dangerous, that is unsettling, or alone by themselves in their own mind and in this confusion. And so fundamentally, we have to get out of this as soon as possible, because we know the impacts are going to be great. And of course, yes, we are seeing it right now. We're seeing rises in suicide and overdose rates. We're seeing rises in sexual and domestic abuse. And so there's a lot that we're going to be unpacking from that. But there's also a lot that we could do better around social distancing itself. I'm a scientist, and thinking through like how this is done. I don't know why every single person has to be by themselves, or why we lock people in certain situations. What we need to do is identify, and there's working folks at the Media Lab and others to be thinking through, what is the number that you need in a commune, right? You don't need every person to be by themselves. You just need isolated units. And ideally, like enough of an isolated unit where there's safety around children and others, or everyone's in a safe spot. I think that we could be doing a lot more to think about that. And as we start to return to work, I hope a lot of the attention is to that, to try to create safe units of groups of individuals. Same thing with this question that is also near to my heart, watching all of my staff trying to work while managing childcare issues, is why do we have so many nannies out of work? Why do we have so many people not having childcare? Couldn't each nanny pair up with one or two or three or a few families, and couldn't we work those things out? Let's be creative, not just in the science that we're doing, but in how we manage all of this. That we have a lot of these individuals who are out of work that provide services for homes. How can we do it where we just think about how to create these group communities, small groups, sustained groups that can be themselves monitoring and paying attention and keeping infections out of that group. But anyway, so that's the kind of thing that is, I think, so important to also be thinking about, is how do we get out of this right now, and then how do we think about how to do this in the future in a way that we don't have to expect that every time a virus gets out, we're going to tank the economy, have serious unemployment, and rising suicide and mental health issues. I just think that can't be our new normal. It just can't be. We as a country and as a species, and as a humanity, is better than that. We can be more creative than that.
I couldn't agree more. And safe units of work, that is a great phrase, because you're absolutely right. I mean, it's taking a toll, and I think it's important to acknowledge that isolation and social distancing is a blunt instrument, and it's one that's hard, to overcome, because it's just not what we're used to. So it's one of the reasons why we are investing in, testing and scaling those tests so quickly, and also bringing the manufacturing back to the United States, having more of a domestic supply chain so that we can quickly ramp, whether it's treatment therapies, vaccines, testing kits, all of that, so that, we don't have to go back to a blunt instrument like the one we're living through right now. So thank you for that. Okay, I'm mindful of the time. So Professor Galizzi, we're turning it back to you for this next question. It's from Margaret M. in Marlborough, and she would like to hear about plans for reopening the economy in Massachusetts. What steps will be taken to ensure our safety? How do we think about the phases as they've been described so far?
So I am afraid the details about the 4 phases which were presented by Governor Baker about how we go back to work are very vague, and so I think everybody's waiting for next week to figure out which actually kind of jobs and businesses will be given the permission to start running again. I think the criteria, which is clearly defined, is that the first jobs which will open up are the one where we have a low risk of COVID-19 transmission, which means jobs where there is going to be little customers interaction, or where social distancing is more likely implemented. We don't have many more details than those, and so I think for each single person to understand whether you will be able to go back to work, it will largely depend not only on the type of industry you're working in, but specifically in your facility. Will it be easy to implement some of the overall safety standards that now Massachusetts is talking about? And these safety standards go from, again, implementing social distancing with the infamous 6 feet distance, the use of masks, to the implementation of these hygiene protocols. So we need to have hand washing capabilities throughout the workplace. We need to have very clear schedule and system for cleaning and disinfecting the workplace, training about social distancing and these hygiene measures, a clear system where workers who have symptoms do not report to work, and at the same time a clear path for these workers to go back to work whenever possible. So again, it will depend on the nature of a job, but also on to which extent your facilities is able to address these standards, which seem pretty minimal to me, but again, I'm not the expert here. There are also some other approaches which are discussed. For example, one is the idea of phasing workers back in based on age group, with the idea that we are going to send first back to work the youngest between 20 and 45, and then the one between 45 and 65, and then the even older, because of a clear evidence that older people are more at risk. Now, this is sounds a very reasonable plan. At the same time, we have to think that almost 1/4 of the employed people in the United States are more than 55 years old. So a policy or an approach which will bring first back to work the younger is going to leave behind quite a larger number of people. And also the fact that many people do not live isolated. So to the extent that you have somebody who is slightly older, who lives with younger people who are back at work, we have then the problem of potentially bringing the infection back into the house when the younger person comes back home. There are also, I would like to say, some other approaches that I think we should look a little bit closer by looking at what has worked so far in other countries. For example, Germany has made this policy of not leaving so much people at work, but having people back at work at reduced time, and the state compensates for the difference. And also when they go back, bring them back more in shifts. So having teams of workers which work longer shifts, but they're all together. And the purpose for doing this is that when you bring teams back into the work on different shifts, if one person gets sick, it's more easy to isolate the entire team, but you don't need to keep the entire group of people on payroll home. You will have just the group of people with whom people have been working closely with. So I think there are some other ways we can try to look at how we can potentially facilitate this return to work. But as of now, my understanding is that at least in Massachusetts, we are all waiting for next Monday to understand a little bit more clear direction about what is meant by these are the jobs where people can go back on phase one, because there is a large amount of vagueness on this definition.
Thank you so much for that. There is so much to consider, and so much more as I listened to you speak. So as we get those details, which I think are going to be coming out very soon, we'll have to get you back on so that you can break it down for us. I think we have one. I think we have time for one more question, and then I'll wrap up. This one is from Claire S. in Acton, and she wants to know what's being done to ensure safe and secure elections through 2020. So I'll take this one because I've said this before in previous town halls, and I'll say it again. Americans should never have to choose between their well-being and participation in our democracy. Vote by mail, in addition to expanded absentee and early voting, and safe in-person voting for those who need it, must be readily available as we navigate ourselves out of this pandemic and toward a national election. There are so many lessons to be learned from other states like Wisconsin, where they rolled the dice on public health and safety by holding a traditional election in the middle of this pandemic. I'm proud that the CARES Act, which is the one we passed last month, it included $400 million in funding to help states and local governments prepare for this year's election. And it's great that Massachusetts is expected to receive about $8.2 million from this allocation. Here in Massachusetts, we have an opportunity to lead the nation, as we often do. We should immediately move to expand access to absentee ballots, early voting, and implement full vote-by-mail efforts through the general election this November. And in Washington, Congress has to provide additional financial assistance to states and implement voting safety standards to ensure that elections are being conducted carefully and without burdensome restrictions. There's a whole suite of reforms I believe we can put into practice, which I voted on back in January when I was first sworn in as your representative, and that it includes increased access to online voter registration and extended registration deadlines, a requirement that states halt mass purges of their voting rolls, an investment in securing our elections from foreign interference, certainly robust and immediate investments in the U.S. Postal Service, who will have to handle a massive surge in mail-in ballots, and expanded in-person early voting and mandatory paper ballots. I am pleased that the HEROES Act that we're debating and hopefully passing tomorrow will include an additional $3.6 billion in federal funding to help states plan and prepare for holding elections amid the coronavirus pandemic this November. The legislation also requires at least 15 days of consecutive early voting and ensures that every voter has access to no excuse absentee vote by mail. And this is a huge step in the right direction, and we need Leader McConnell to address fair and secure elections once and for all in the Senate chamber as well. Nothing should stand between the ballot box and a person exercising his or her constitutional right to vote. So it's common sense, and I thank you for asking this critical question, Claire. Sadly, that is all the time we have today. These events always go by so quickly. I want to thank Professors Galizzi and Sabeti one more time for sharing their invaluable insight and expertise with us. I know I learned more as a result of your responses, so thank you. And thank you to all of you again for dialing in and staying informed. For an easy way to stay updated on the federal and state response to COVID-19, as well as information on future Tele-Town halls and events, please follow me on Instagram, Facebook, and Twitter at Rep. Lori Trahan. You can also visit trahan.house.gov/COVID-19 for resources that are important to your family and your small business. And if you're feeling the mental and physical burden of this crisis, or you feel like the isolation is getting to you, one, know that you're not alone. It's important that you realize that your family and friends are all here for you, and so am I. If you or someone you know needs assistance in any way, please don't hesitate to reach out to my office. We're here to help. And you can reach us at 978-459-0101. Again, that number is 978-459-0101. We're all teleworking, but we pick up that phone every time it rings. Finally, and I can't say it enough, we all have to continue doing our job over the next couple of weeks. And For most of us, that means staying home, washing our hands, maintaining a safe social distance, and wearing a mask when we go out in public. Remember, it's not only for you, it's for everyone around you, and it's absolutely essential to keeping our emergency workers healthy and working for the rest of us. We will get through this difficult time, and as long as each of us continues to do our part, we'll get through it together. So thank you again. Stay safe and stay healthy.
Thank you.